This information is for educational purposes only. It is not intended to substitute for professional medical advice and should not be interpreted to contain treatment recommendations. Remember to follow instructions for use for the product you are using.
Hi, I'm Karen Spriggs, one of the clinical consultants and Peristeen Plus clinician trainers for Coloplast. Also joining me today is Belinda Coyle, another clinical consultant for Coloplast. Peristeen Plus is a transanal irrigation system that helps people with neurogenic bowel dysfunction manage fecal incontinence and/or constipation as independently as possible based on individual function. It is a second-line treatment option designed to help those who cannot get sufficient relief from conservative bowel management. Today, we are going to do a Peristeen Plus product demonstration intended to assist clinicians in training patients how to use Peristeen Plus. Training is critical before patients perform their first irrigation on their own. In preparation for Peristeen Plus training, you need to gather the items you will need. The following items are part of the Peristeen Plus system: water bag with temperature indicator, control unit with pump and tubing, straps as necessary. Rectal balloon catheters are shipped separately and are available in small and regular, also referred to as a standard length. Make sure you have water on hand as well for the training. The first thing to do in training is to fill your water bag to the top with tap water. For training purposes, the temperature does not matter, but should be body temperature for irrigation. Your patients will need to know how the water temperature indicator works. When it is green, between 93 and 104 degrees Fahrenheit, the temperature is suitable for irrigation. When the temperature is below 93 degrees Fahrenheit, the indicator will be blue for too cold. When it is above 104 degrees Fahrenheit, the indicator will be red for too hot. Peel the catheter package slightly open, but leave the catheter in the package so that you're able to activate the hydrophilic coating on the catheter prior to inserting it into the rectum.
The next thing you'll need to do is put the parts together. Attach the tube with the gray connector to the gray screw top lid. The big tubing goes to the big hole, and the small tubing goes to the small hole. You want to make a T, push it, and do half turn clockwise to lock. Pull gently to make sure it's securely connected. Then take the tube with the turquoise connector. This will attach to the control unit and the catheter that you've peeled open. Attach one end of the tube with the turquoise connector to the control unit. Big tube to the big hole, small tube to the small hole. Make a T, push it, and do half turn clockwise to lock until you hear and feel a subtle click. Pull gently to make sure it's securely connected. Do the same to attach the other end of the tube with the turquoise connector to the balloon catheter.
The next step is prepping the pump and catheter. Attach the catheter to a wall or place it upright in its packaging in a glass. Start by turning the knob to the turquoise water symbol. Squeeze the black pump until the water fills up the catheter packaging. This may take 2 or 3 pumps to get the water through the tubing. When the packaging is filled with water, turn the knob clockwise to the white balloon symbol to stop the water flow. Leave the catheter in the water for at least 30 seconds to activate the hydrophilic coating on the catheter.
The next step is to inflate the balloon. We already have the knob pointed to the white balloon symbol. Don't pump the balloon yet when you're doing a patient demonstration though. I'm going to inflate the balloon here for you now so that you can see what the balloon looks like when it's inflated outside of the rectum. This is 1 full pump. And this is 2 full pumps. A full pump consists of squeezing the pump completely until its inner walls touch each other. You can see that 2 full pumps will usually be enough to occlude the sphincter muscles. When doing the procedure, the patient or caregiver should be holding the catheter by the finger grip below, this turquoise dot. They should not be holding it back here, as they may place the catheter too far into the rectum. You're going to gently put the catheter into the rectum. We're going to deflate the balloon first. And do not pass that finger grip. If there's any resistance, you want to stop, reposition, check to make sure there's no stool in the rectum, and if possible, try reinserting the catheter again to make sure that it goes in easily.
Once the catheter is in the rectum, squeeze the black pump to inflate the balloon. After one pump, gently tug on the catheter to ensure it is properly placed in the rectum. If the catheter isn't placed properly, the balloon may be pumped in total twice for the small catheter or 4 times for the regular or standard catheter.
The next step is pumping water into the rectum. Make sure that the trainer and patients or caregivers know that they need to go back into the counterclockwise motion along the turquoise line that serves as a guide. If you go in the clockwise position, you may end up passing the gray deflate symbol that will deflate the balloon and you'd have to start all over again. Turn the dial counterclockwise to the turquoise water symbol to slowly start pumping the water into the rectum.
Once you have all the water instilled into the rectum, deflate the balloon. Again, you want to follow a counterclockwise motion and turn the knob to the gray deflate symbol. Once the balloon is deflated, the catheter may fall out on its own. If not, you may need to give it a gentle tug to remove the catheter from the rectum. Have the patient sit on the toilet for 10 to 30 minutes. This is when they can stand up, massage their belly, move around on the toilet, or anything that can help them facilitate a proper bowel movement at this time.
Disposal of the catheter is easy. When you're done with the system, put the catheter back into the packaging, disconnect it from the unit, and throw it in the garbage. When finished, it's time to clean up. The patient needs to wipe their bottom. You then unscrew the water bag from the tubing, rinse the outside of the tubing and lid with warm soapy water, and rinse off. Once you have cleaned up, to store the system, turn the knob to the turquoise finish and storage symbol. This opens up all of the tubing so that any extra water that's left in there can drain out and dry overnight or until the next time the patient uses the Peristeen Plus system. Thank you.